Moving on to the dense connective tissues. This will include dense regular connective tissue. This type of tissue is primarily going to be collagen fibers, and you will remember that collagen has an incredibly high tensile strength. Gram for gram, it is stronger than steel. And because of that, you want to find it in places that have a lot of shearing and take a lot of damage, or areas where there might be a lot of damage. And that is going to include tendons and ligaments, because we put a lot of stress on our muscles and our bones. Tendons attach muscles to bones, ligaments attach bone to bone. So this will function to provide attachment between muscle and bone, or bone to bone. It takes a long time to heal because it is relatively avascular. So slow to no healing. If you've ever had a ligament problem or a tendinopathy like tendinitis, it takes a very long time to heal because of lack of vascularity. And this is what it looks like. Types of cells that will be associated with it will be fibroblasts. And again, you're going to have these parallel bundles of collagen fibers, which also often kind of look wavy on appearance. Dense irregular connective tissue will also have a lot of collagen fibers in it. Again, remember the tensile strength. However, the fibers are going to be randomly arranged. So where do you find this? You're going to find this in the integument system, in the dermis of the skin. So it'll be deep to stratified squamous epithelium when you're talking about the skin. It also makes up the heart valves. And again, its function is to provide a lot of tensile strength. In this micrograph, you can see dense irregular tissue that's going to be sitting deep to the stratified squamous epithelium of the skin. The basement membrane has been outlined in black, and you can see the arrow pointing down toward that very first layer of squamous cells that have just undergone mitosis. Elastic connective tissue, what a surprise, is going to be primarily made up of those elastin fibers. Remember that elastic connective tissue is going to have a lot of stretch, as well as the ability to return back to its normal resting position. So where are you going to find this type of tissue? In areas where you need organs or structures to expand and then contract. Think about the walls of the lungs. You're going to find it in lung tissue, as well as in the walls of the aorta, as well as other large arteries, because those arteries have to be able to handle the force of blood when it is shot out of the left ventricle and then return back to its normal resting position once that blood has passed through. So its function is durability with stretch. Now this one reminds me of the crinkly edges of lasagna noodles, and that is how I used to remember elastic connective tissue, because it looks like those edges of lasagna noodles.